All right, so our first presentation tonight is going to be by Dr. Paul Moayyedi, and he'll provide an overview of research studies that aim to provide an understanding of the interactions between diet microbiome and finding new therapies for the treatment of IBD and associated psychiatric disorders. Dr. Moayyedi is a professor in the Department of Medicine here at McMaster University, the Director of Clinical Research at Farncombe Family Digestive Health Research Institute, and the Director in the Division of Gastroenterology at Hamilton Health Sciences. He has a strong interest in evidence-based medicine. He has conducted a number of large randomized controlled trials that have evaluated functional and organic disease of the GI tract. He has also published several systematic reviews that have been influential in British, American, and Canadian national guidelines. He is the joint coordinating editor of the Upper Gastrointestinal and Pancreatic Diseases Cochrane Review Group based at McMaster University, and is also co-editor-in-chief of the American Journal of Gastroenterology. Currently, Dr. Moayyedi leads the IMAGINE Network, and he and his team will be developing innovative therapies and novel probiotics for inflammatory bowel disease and irritable bowel syndrome. Please join me in welcoming Dr. Moayyedi.
Thank you, Penny. Thanks to Colitis Canada for inviting me. It's a pleasure to be here. And as Penny said, I'm the principal investigator, co-PI of the IMAGINE Network. So what does this stand for? The IMAGINE is a nice acronym, but it is a bit of a mouthful. But it's all about the inflammation, microbiome, which is to do with bacteria, alimentation, GI, and neuropsychiatric effects. It is a network that is truly national. It covers all provinces but Prince Edward Island, and has about 17 centres involved in the study. So much of what I talked about isn't just happening here at McMaster, but across the country. The other thing to say about this network, it isn't just about gastroenterologists. It's truly multidisciplinary, so you have psychiatrists, microbiologists, including Mike and Mo here, economists, epidemiologists, and most importantly, patients, which Ida will talk about, which are involved in this. And as Penny said, the overarching hypothesis which this network is trying to address is how the diet and gut bacteria interact, because after all, what we eat feeds us, but it also feeds our gut bacteria, and how those things interact to cause inflammation in the gut, and that in turn leading to diseases such as inflammatory bowel disease. The other element of this is it's well known that patients with inflammatory bowel disease are more prone to suffer from anxiety and depression than you would expect, and that work from McMaster and suggests that maybe some of that relates to our gut bacteria. And there actually are bacteria in our gut can influence our mood, which is a fascinating work. So what the network will do is, first of all, develop new therapies that modulate that gut bacteria to improve inflammatory bowel disease, IBS, and mental health. As well as that, we hope to show that with these data, how to make existing treatments better by making the treatment more personalised and more predictable who is going to respond to which treatment, so that we can get to individualised patient care. And the central theme of this network is to do a large cohort study of 2,000 Crohn's patients, 2,000 ulcerative colitis, 2,000 with IBS, and 2,000 healthy controls, which don't have GI symptoms, don't have these diseases, and are age and sex match to the people who are participating with Crohn's and ulcerative colitis. And we're going to give a lot of, a very exhausting number of questionnaires so that we can understand the disease as best we can from their symptoms, understand how it might be affecting people psychologically, and also a very detailed dietary history. And then we'll also collect stool, urine and blood so that we can look at gut bacteria in stool. Urine, we can see the metabolites of those bacteria and what they're doing. And blood, we can look at standard genetics as well as subtle inflammatory markers that may tell us what's going on in ways that haven't been looked at before. And we'll follow people up annually for up to 5 years to see whether these changes in bacteria or inflammation predicts who's going to do well and who's not going to do not so well with their disease, and whether it predicts a response to certain therapies. So that's the backbone of it all, but there are a number of other trials and studies that are going on throughout these 5 years to try and give better treatments to patients with ulcerative colitis and IBS. And so these are summarised here, and you can see they're not all starting on day one. Some of them start soon, some of them in a year or two's time. So the first one to emphasise is fecal microbial therapy in ulcerative colitis. We did the world's first randomised trial of this compared to placebo, and this was funded by Crohn's Colitis Canada, as well as another grant, and it showed promise. About a quarter of the people went into remission after week 6. So the information from that we have used to try and make the treatment better, and we're doing another trial to see if giving antibiotics before the fecal transplant actually improves the overall efficacy in patients with ulcerative colitis, putting them into remission. It's important to study this because what you're using, feces, is readily available. So patients can do this at home. This is an example of that here. You just need a blender and some water. But not very pleasant, and when done uncontrolled can be dangerous. So we hope to bring science into this and really understand how to make this treatment work effectively for ulcerative colitis patients. So we've done this in ulcerative colitis. As I said, we were the first to do it. There are now 4 studies that have looked at this, and overall the same message is happening. Be it a study in Australia, Europe or here, it does seem to work. What hasn't been studied is the same sort of approach in Crohn's disease. There has not to date been any randomised trials of this in Crohn's disease, and part of the reason is that usually affects the small bowel, and we give fecal transplants normally in the other study by an enema, so it won't really reach the area that's inflamed in Crohn's disease. So a group in Edmonton, led by Karen Madsen, has developed tablets where you can encapsulate the bacteria in tablets and swallow a lot of tablets, but they're aimed to release at the area of inflammation. So we hope to start a study soon that will be in Edmonton, Calgary and here in McMaster, evaluating whether this works in Crohn's disease as well. Other studies are going on, so if you have inflammatory bowel disease, you no doubt had an endoscope at some point in your life. And that uses just standard light, at least usually. but there is innovative work which suggests we can look much deeper into what's happening in the lining of the bowel, and maybe this can identify those that are going to do well with treatment or identify those that are going to relapse. So this will be studied principally in Calgary. And finally, as I said, that there is increased risk of anxiety and depression in patients with inflammatory bowel disease. So we're looking at whether talking therapy, cognitive behavioral therapy, given across the internet, so talking virtually, will be helpful in depression and anxiety in IBD patients and maybe help their quality of life, but also perhaps even their disease activity. So this is another study that will be ongoing, and this one will be led out of Winnipeg, but available because it's online across Canada. And then if we move on to irritable bowel syndrome, we will look and see if new diets can affect and improve the symptoms of people with IBS. We've talked about this low FODMAPS diet, which stands for fructans, oligodyne, monosaccharides and polyols. The bottom line is it's fermentable foods. So they can't hear me.
No, they can hear you, just a little bit of static.
Okay.
Just better walk.
Right, there we are. Happy now? Good. We will, through that large cohort study, we'll see if there are any foods that seem to precipitate symptoms, and see if the randomized trial of withdrawing those foods versus a sham diet can actually improve symptoms. And finally, we mentioned that there were studies in animals that suggested that gut bacteria may affect our mental state. And we've done some pilot work in people with this probiotic, Bifidobacterium longum, and it seems to improve mental health as well as symptoms. So we hope to do a trial of this, although this will be an irritable bowel syndrome, not IBD. But we hope that we'll be the first to show that actually in people modulating gut bacteria will improve mood. So the other important things to emphasize about this, there is a strong patient engagement component to this. We need to educate and train the next generation of scientists coming forward, as well as make sure the knowledge is transmitted to those that need it, i.e. patients and policymakers. And also there's health economics to make sure we're spending tax dollars wisely. And at this point, first of all, I'd like to thank everyone in the network. There's over 70 people in this network, some of whom are in the audience. Ida is our executive director, who used to be with Crohn's Colitis Canada. John Marshall is leading IBD here at MAC, and Mike Surratt is leading the evaluation of gut bacteria, and he'll be talking soon about that. But I'd also like to thank our partners that have funded this, particularly CIHR, who have given $12.5 million to support this study, and various universities that have put in generous sums of money to match those dollars, including McMaster University and the University of Calgary. Each put approximately $5 million towards that. And in the case of McMaster, that is a lot of that relates to generous donation from the Farncombe family. Also, Crohn's Colitis Canada, who've been very generous in supporting the network, as well as CDHF and CNG, and industry partners, Takeda and Allergan. So with that, I will pass on to Ida, I guess. Yeah.